I am so happy because we are going very much forward. Puberphonia, I am going to make it worldwide teaching center in Siva ENT Hospital, Chennai. Already I know more than 25 doctors, ENT surgeons have registered themselves. They have accepted their willingness to participate, to learn Puberphonia. So this is really a great occasion for me. Today, May 16th, Saturday. See, last week we have made a small MOU with Kalasalingam University to teach Puberphonia. A certificate course, advanced certificate course, diploma course, and other related course they are willing to give to us. So as a beginning, we are going to start a certificate course for doctors to know about Puberphonia. Doctors know everything about Puberphonia. So what is there to teach? But the awareness program is not picked up very well. Still the world feels it is a rare problem. If I say it is a common problem, that is a controversial thing. They say it is a rare. How can you say it is a common problem? So I continue to say that it is a rare problem, but the awareness should be there and more people should opt for treatment, because still there is a feeling that Puberphonia is incurable, and some learned people, even non-medical people, will tell what Puberphonia. He is normal. He can live long with a puberphonic voice. You can tell like that. But what is the feeling of that boy? He wants to argue. He wants to stay in the stage and dictate what he knows. He wants to take classes. See, today, the internet today. See, your voice is an asset for you. So if you are not able to communicate with a good manly voice, what will happen to you? So that they have understand. So we have a great opportunity with Sri Ramachandra Medical College, Medical University, bioengineering students. See, luckily, 4 students has completed their course with us in Puberphonia virtual reality. The whole credit go to Mr. Logesh, because his student is a bioengineering student of Sri Ramachandra University. So the head of the department of bioengineering department is very kind enough to link with us in studying this Puberphonia research. By their research, what we got is a great thing. Another big opportunity for UND surgeons we achieved. That is the voice booth. We call it I Love My Voice booth. That booth is created with the visionary of Logesh, myself, and the 4 boys of Sri Ramachandra bioengineering students. With the help of the professor, they have created a booth. If you enter into the booth, a privacy is there. You can assess your voice range, whether it is childish, female, male, or with singles problem or old age problem. See, we want to create the next step. Another 4 boys the bioengineering professor had said us, the next step, whether anything to do with dementia or Parkinsonism or old age or other problems, we are going. See, still a definite idea is not there, but this is very confident. You can assess your voice when you enter into the voice booth. I want to create thousands of voice booths throughout the Chennai, India, Tamil Nadu, India, all over the world. Just like measuring your height and weight, you can measure your voice. Confidently, you can go alone. You speak to them. You speak to that booth. I can give you a QR code, or the great thing is there. That is Puberphonia Kumaresan app that you can download. You enter your name, then an option will come. You press it, your voice will be recorded. The same voice once again will repeat, you confirm, then it will go to the AI and measure the frequency. What is the frequency of your voice? High pitch or low pitch? And it will give you a result. So if this voice booth is installed in every where the people are meeting, students are meeting, so they'll have the opportunity to measure the voice. It will give you a clear indication that it is a treatable problem. So you can treat it. So ENT surgeons are telling it is a rare problem, no case we have seen. No, it is, they are seeing the cases. I know. I have recorded who are all the ENT surgeons seen, definitely. But they are reluctant to treat it because they said to the option for a speech therapist. Speech therapists are number one in treating puberphonia. They are doing good job. But it may take long time. That's the thing. Patient has to follow, speech therapist has to follow. So it will take long time. There is a gap in the treatment of puberphonia. If you leave it, then you will be frustrated and you won't be interested in doing the treatment as scheduled by the speech therapist. Lot of good speech therapists, they are doing enormous good job in treating puberphonia. I am not against it. I am not telling they are not able to do it. But what I am doing is, when they are come for treatment, I am putting them as a inpatient in my hospital. They have to stay for 5 days. So they will be here. 24 hours they will be here. 24 hours they will practice. Practice makes the man perfect. Added to that, my principle is, even though it is a new venture I have taken, initially you try to speak with the pharyngeal voice. You use your mouth, throat, nose to create the voice. No doubt, voice is originated by the air from the lungs. It makes the vibration of the vocal cord. So fundamental frequency is there in the vocal cord. I am not objecting. Fundamental frequency. It is modulated in the pharynx, where the uvula, soft palate, tongue acts, and resonated in the mouth and nose and sinuses. This is fundamentally clear. But there is a modulated voice. I heard a sufficient proof pharyngeal voice is there. Pharyngeal voice, a separate category. Larynx produce voice, okay. More than that, pharynx can produce a voice. Already literature support is there. There is a proof in the Google, a girl who had papilloma of the larynx underwent tracheostomy. Somehow, she tried all the methods, esophageal speech, or tongue speech, oral speech, but she had developed a pharyngeal speech. Without the aid of the vocal cords, she is able to talk, sing, everything. A papilloma larynx with tracheostomy. This is there in the Google. A written evidence is there. Pharyngeal voice is there. Without usage of the vocal cord, you can make sound, you can talk clearly. So that supported me, definitely. So added to that is a great advantage is if you practice pharyngeal voice, a male voice, you will get it. Okay, you get the male voice. But vocal cords are there in this patient, Puberphonia boy, normal vocal cord. See, a good function will be taken over by the vocal cord and resonated by the nose, the pharynx, and everything. So they will get the voice when they recognize their ancestor voice. The beauty is we are not doing any mutilated surgery at all. We are not doing speech therapy. We are doing voice therapy. The frequency only we change. Try to understand. So pharyngeal voice is produced, create a male voice. The Puberphonia boys are having normal vocal cord, so they will have a permanent high pitch is converted into low pitch male voice permanently. See, there are a lot of evidence for me to talk. The pharyngeal voice is there in Hebrew and the other languages. Originally, a pharyngeal voice is there. But somehow, this pharyngeal voice is not taken very seriously by English literature. They say that voice is not there in English literature, definitely. But in Tamil or South Indian language, I know that pharyngeal voice is there. It is attached with even so many occasions. See, in our culture, when good functions are take place, they use pharyngeal voice, ululation, ula. So ula, they rotate and make noise. See, directly they are not telling about ula. You rotate the ula. So every literature says there is a posterior part of the tongue touches with the posterior pharyngeal wall or hard palate. Definitely, it touches the uvula and soft palate. Soft palate, where at the end you are having uvula. When we read about the uvula, it is just like a bell, the shape of a bell. The tongue is there, the bell, so it strikes the walls of the well and make the noise. Similarly, the description is there, but they are not concentrating on pharyngeal voice. We are taking it seriously. That pharyngeal voice is there, which is manly voice. This is what my feeling. That's all. I'm just going to prove it strongly. See, laryngeal voice is there for female children, all male and female children. Up to the age of adulthood, laryngeal voice is there because it is high pitch. Why high pitch? If child or lady, when they are in agony, when they are in trouble, they make high pitch voice because others should come and help them because of their shouting, their pitch that will reach different places. They will be helped. But when man become manly, he won't cry. He won't make high pitch. He had only low pitch sound. And instead of crying, he used to fight and win over the situation. That is the feeling I am having. That is the developmental stage what you get. That is why the laryngeal voice is predominantly in female and children and pharyngeal voice in male. But this break has not happened due to so many multivarious causes. But there's no hormonal, no structural, no psychological problems involved in that. Try to understand. All Puberphonia boys are very intelligent, but they are not openly coming out because their voice make them so inferior in the society. So that's why from the beginning of the day itself, I used to tell these boys, Puberphonia boys coming for treatment, it is not only change in your voice, but change in your life. That is, you should be able to understand. The second point, see, these boys are there with me 24 hours in my clinic. So practice makes them perfect. Second point is, they are coming in group. I am requesting them to come on every Monday. They ask me Saturday, Friday, every day you can come, but preferably you come on Monday. Now also I am requesting all to come on Monday because a group will be formed. See, every treatment there is a failure is there. Not failure, delay in training, that's all. Delay in recognition. Long time it may take. But when they are in group, this delay is very much a negligible one. That boy is having good speech, why not I? That is the thing. They practice with the boy who had already got the good voice. That's what I am telling. More than 80% for the first day itself, they recognize their ancestor voice. They got the voice. Then and there, the high frequency voice may come. But when they recognize their ancestor voice, where is the chance for recurrence? So 2 points are with me. The boys are there with me 24 hours for 5 days. Second is group therapy. So these two things only increase the success for treatment of puberphonia at Siva ENT Hospital. Now we have created, very important thing, now we have created a booth. So all ENT doctors, all MBBS, you can come and practice with me. Know what I am doing. Okay, this is only 1 day, but online I'll give training for more than 3 months because my view all should understand how the uvula moves, how it vibrates, how sounds are generated. We have our own method of treating it. Every day, just not simply. They have to do, I have modulated more than, see, just like this voice booth, I have created Kumaresan's Puberphonia voice index. That is also available in the literature. So you can assess it. So now we are going for AI. AI, see, this is the booth containing AI also. It will diagnose your problem, then you will understand your voice is like that. There is a small note will be there. It is a easily curable disease in 5 days. So that makes them. So if it is installed in one X hospital, this booth is installed. This boy, knowingly or unknowingly, enter into that booth. Yes, why not? I test my voice. I feel my voice is not up to standard. Why not I just try? He just speak, register, speak. Okay, a mic will be there. Or you can use your own cell phone. Then it will measure your voice frequency. And within a few minutes, it will tell what is your frequency. You can take printout or can just copy it with that thing. Then you really recognize your voice is puberphonic, high pitch. Then there will be a small note in the book. You contact the local doctor. So every hospital with ENT doctor, ENT assistant, or ENT postgraduate, when they want to have more cases, this recognition of puberphonia and available for treatment for puberphonia should be available. So those who are coming to learn about the treatment of puberphonia, we will install a booth. Then only they will get the case. So many years they are ENT surgeons are working, no case. Yes, definitely audiologists and speech therapists are getting lot of cases, but ENT surgeons, in my knowledge, they are getting few cases only, but lot of cases are there. If you install the booth, so that is what I am spreading the message. I have created a app, Kumaresan Puberphonia app, a free download app in their cell phone itself. Now, all ENT doctors, ENT students, medical college, all the places I'm going to install the puberphonia or voice identification, voice measuring booth. That's all. Where you can see, now we have found out whether your voice is male or female or old age problem or other thing. Then next, our research will go in which problem you will probably have this problem. You are a precancerous condition, papilloma, polyp, vocal nodules, old age, paralysis. See, these are the things now. It is not there in the literature, but we can do it with AI. That's what I am saying. If you find out online treatment is possible by virtual reality, great thing. So AI is there in ENT, virtual reality is there, AI for diagnosis, know the progress. Virtual reality, you can teach them in online. You can measure how much improvement is they got it. So ENT and voice care, it had gone into the modern world of AI and VR. I pray God, all these things are possible only because of initiated by the Sri Ramachandra University bioengineering students, Dr. Jayanti, Professor Jayanti. I have to thank her, which is initiated by her students, Dr. Professor Jayanti, Mr. Lokesh. And the great thing is helped by my neighbor who is interested in AI and virtual reality. We are going another step. AI attracts many students and doctors also. Oh, this fellow is doing AI. This is only because of the modern development. Senthil Kumar, very good people, helping me lot. Who is the instrumental for finding out Kumaresan Puberphonia app? See, in the Google, my name is there. It is only because of Mr. Senthil Kumar. With all the things, with the help of Malaysia Monica, he has introduced me the Kalasalingam University Vice Chancellors. So we have come out with a course for teaching puberphonia. It is not purely teaching, identification, that is the main thing, awareness. So identification, awareness is for the public and medical students. I am more concentrating for all medical students, MBBS students. This should be a chapter for awareness and identification. No doubt the treatment by ENT professionals and speech therapists. But identification should be done by all, because there are a lot of cases of puberphonia. We have to treat it. I'm so happy. We have treated more than 1,720 cases of puberphonia. This is really, I personally feel it's a world Indian record. I got the certificate, but world record I have not yet got it. But in my mind, I got it. That is not the thing. It is there only. I am not created anything. But Sri Ramachandra Medical College students has created, with the help of Professor Dr. Jayanti, the voice recording room, a booth. If I install thousands of booths in Tamil Nadu, what will happen? Lot of boys will come. The end result is, it is simple treatment, no surgery, no medicine, only training. When younger generation in the treatment of puberphonia, they will do it in a very simple manner. And they need not have the help of Avayar, Tirumolar, Tolhapiyam, Undi Mudalam, Undi Validondi, all the things, they never record, they simply do it. So, number one, only the research now had gone. It is there, the second phase. Senthil Kumar had taken. But all the credit will go to Kalasalingam University. They are the people given me more encouragement. I have to thank them. I pray God that we will meet next Saturday, the same time. Thank you. Great. Happy.